Welcome everybody from near and far, family, friends, sisters. Welcome to our Frontline Jewish Healthcare Workers panel conversation. If you are not muted, please mute yourself. Core Connects is an organization that was started to create unity amongst Jewish women, to create community amongst us, that we should be able to gather, we should be able to find safe spaces to grow and support and inspire each other. So we do a lot of different things. We have book groups, and we used to have in-person dining. We don't do that anymore, but we have an interesting program. Our next program is March 7th. We're going to be traveling via Zoom to Sfat, Israel, where there's a wonderful woman who is a glass blower, who's going to give us a tour of her gallery and a demonstration of her art, and infuse it with Torah wisdom, mysticism, and Torah wisdom from the city of Sfat. So that's on March 7th. We have some book groups coming up, one of which is a sequitur to last month's book group, where we read The Gifts of Imperfection by Brene Brown. And what came out of that was that women wanted to continue the conversation. So we'll be journaling and working on that book. So if you're interested in that, I'll send out an email about that coming up. And then just stay tuned for our upcoming programs. So tonight we are very excited to welcome our guest speakers, who are all local women. All our speakers on these panels are local women that who are women who are on the front lines. They're Jewish local women who work out there in the community. And I thought it would be really interesting to hear from them how they view their work and what they do, and how they do what they do, and how they hold up against all the that's sort of out there in the world. And so the order of our speakers tonight, to keep you all in suspense. So I'm going to call on Ceceley Chambers first, who is a hospice and pediatric palliative care chaplain and spiritual director. So she will be our first speaker, followed by Lisa Shea, our friendly resident adult psychiatrist, followed by Linda Steinhardt, who's a certified nurse midwife and family nurse practitioner. And then Rebecca Ginsburg will be speaking on being a physician assistant at Rhode Island Hospital. And so then I asked people to speak 10 to 12 minutes-ish. And then at the end, we'll come back together and have a conversation. People have questions, people have reflections or thoughts or their own experiences, to please share those, and we can keep the conversation going. So without further ado, I'd like to introduce Ceceley Chambers, is, as I mentioned, a hospice and pediatric palliative care chaplain and spiritual director, with a passion for bringing a little light and peace into people's lives. She trained to be a chaplain through Harvard Divinity School and Hebrew Senior Life, and as a service leader and spiritual director through Aleph, Alliance for Jewish Renewal. Ceceley often leads services in the Soulful Shabbat community, and is a mikveh guide and educator at Mayim Chaim, which is in Boston. She lives in Providence with her husband, 16-year-old daughter, 13-year-old son. And I would like to now turn the focus onto Ceceley, and I'm sure we're all very anxious to hear what you have to say.
Thank you. Nice to see everyone. So my first question is, okay, touch your nose if you know what a chaplain is. Okay, that's pretty good. It's a big chunk of you. It's impressive because I actually didn't know what a chaplain was until I went to school to become a chaplain. So, you know, chaplain was never a word that I heard growing up. I went to college, and chaplain was not a word I heard. So instead, I decided when I went to college, I studied religion, comparative religion, and I was really interested in studying Christian mysticism, because to me, it was like the exotic other, right? Like I was really, it sounded fascinating. And so I went to graduate school at Harvard Divinity School, and I was there for like a couple of days when I learned this word chaplain, and I said, oh no, that's what I want to do. Because I really like talking to people about God, or, whatever word they might use for God, right? Universe, whatever that is, which is greater than ourselves, right? And so that's what I wanted to do. And what's really cool about chaplaincy training is that we get to learn a lot about our own beliefs and our own we have to be very solid in our own religion and our own foundation, so that we can walk into a room and be presence to, whoever we see, right? So as a chaplain, even though I am strong in my Jewish faith, I see people of all religions. I often say I see the very religious, the anti-religious, the spiritual but not religious, kind of everywhere in between. And it's my job as a chaplain to be whatever people need me to be in that moment. So I often say that as a chaplain, I'm a source of support for a patient and their family. My favorite description of a chaplain is, if you ever find yourself in a dark room and you're feeling around and you feel something soft and squishy, that's me. I'm the soft and squishy thing that you feel. Yeah. I'm here. It's not necessarily my job. Muted? Hi, Jerry Dorfman. You are not muted. We can hear everything you say, but that's okay. We love you anyway. So soft, squishy room, soft squishy thing, that's me. Like, I'm here with you in that dark place. And it's not my job to say, hey, dummy, there's the light switch, or like, why don't you climb your way out? I'm here to be with you in however you are. And I think, my own belief is, just by having somebody with you in those really dark times helps, right? Even if it helps a little bit. So I will say that anytime I tell people that I'm a hospice and pediatric palliative care chaplain, they always go, oh, what you do must be so hard, right? And yeah, like, sometimes it is hard, but believe it or not, there's a lot more joy in what I do than one would think. I have a lot of laughs. I had a patient not too long ago that told me this hilarious story about her two sons and the antics they did. One time they opened their window and threw their mattresses out their window and then jumped out of their second story window, right? So I'm hearing these hilarious stories from people, and there's a lot of laughs. I once had a patient whose bucket list, he unfortunately had pancreatic cancer, but his bucket list was entirely foods that he wanted to eat. So it was like, I want to eat a murder burger from Haven Brothers. I want to have a Philly cheesesteak, which, for those of us who keep kosher, we don't eat Philly cheesesteaks, but still, like, it was kind of funny. Like, this was his goal. So there's a lot of laughs. I have a lot of laughs. And I will say that since COVID, it has been, there's no doubt about it, it has been really, really hard. My job, which was always hard, but always wonderful and joyful, has become just a little bit harder. It's always been part of my job description to do staff support, and staff support is something I'm really passionate about, supporting the nurses and the other frontline professionals, the doctors, the nurses, the social workers, the other people who work with me on the team. I lead a monthly staff support group for my pediatric team, and I lead daily reflections for my hospice team. And since COVID has hit, I've been doing a lot more staff support than I ever did before. I think it went from staff support was about 20% of my job to like 40% of my job, and some days probably more. Our staff has had a lot of losses, and they are wrestling with a lot of these losses while also holding other people in their losses, which has been really tough. One of the things that I did that I'm pretty proud of as a chaplain is that, so since COVID started, the nurses and the aides have had a new responsibility to their already long list of assignments. And it is to, when someone passes, they have to put the body in a body bag, which is not something they ever had to do before. This was something that was usually done by the funeral home. and they had to do it. And to them, it felt like a horrible violation. It just felt like this horrific thing that they had to do. And I had one nurse say to me, I ask God forgiveness. I ask God for forgiveness every time I do it. And, you know, that's a tough thing to deal with. And so I thought about it for a bit, and then we talked about it. And I said, well, what if you change in your mind what you're doing? What if instead of thinking of it as you're putting this body in a garbage bag that you're throwing away, think of it as you are taking this body and putting it at a sacred vessel that then is peacefully transitioned to its next location. And so I created this process now where I bless all the body bags. And I gave instructions to the staff on how they can bless the body bags so that they can really think of what they're doing as holy. So that's something that I did that I feel really good about, because it's just like, it's a little thing in some ways, right? But it's a slight shift in the thinking. And so by doing that, we helped transition that act that felt so profane to like the sacred act. And I think a lot of what I do is because of my connection to Judaism, right? Like, so I'm definitely on the crunchy granola hippie liberal end of Judaism, but it's still an important part of who I am. I have a solid prayer practice. Every morning I wake up and I thank God for giving me this life. I thank God for my family, many of whom are here. Hi, Mom. Hi, Ralston. Hi, Jeanette. Love you guys. I thank God for my friends, for Rebecca and for Michelle, who's also here. Hi, guys. I thank God for my colleagues, both past and present, because I've been so blessed to work with amazing colleagues. And I thank God for giving me this work to do. And I ask to keep an open heart. I often say my prayer in the morning is, may I have a big open heart, but with good boundaries, right? So this is the key. One of the positive things that has happened since COVID is that chaplains have a lot more support now that we've never had before. There's been a raised awareness of what we do. There's been articles about us in the New York Times, which has never happened. And there's been a proliferation of staff support groups, chaplain support groups, which is pretty amazing. I've never felt so supported now that I do. And that's the only reason I can do it. I can do what I do, which is really, really hard, because I have that solid foundation in prayer, because I have a spiritual director who loves me and holds me in that and loves me even when I have bad days and when I have good days. I have many Havruta partners, many people that I count on support. I have a peer spiritual direction group, a peer supervision group. And that is what gives me the strength and my faith, right? So I do gratitude in the morning and forgiveness at night. So I always beg forgiveness at night before I go to bed. Usually my forgiveness also, it's often about drinking water. This is my new thing. I've been really trying to drink water because I don't take good enough care of my body sometimes, right? I'm so involved with taking care of my patients and their families, and then coming home and taking care of my own family, that I forget to actually take care of myself. So drinking water right now. And I think, have I gone 10 minutes? I could go on for like hours. Have I done 10 minutes?
That's 10 minutes. We can come back. I think we'll go through the lineup, Ceceley. I think that you set a really nice tone for us, and thank you for sharing, and thank you for kind of giving us a glimpse into your world and what you do and how you do it. And we thank you, really, all of us, I'm sure, now have a different sense of who a hospital chaplain is, and you specifically, and the open heart that you describe is one that we feel as you speak. So we'll come back. I'm sure people will have some questions. So hold in, don't go anywhere. And I'm now going to call on my friend Lisa Shea, So I actually met Lisa a number of years ago. She came on a trip to Israel that I led. Now I'm going to hear a little bit more about what she does as a psychiatrist at Lifespan Physician Group and Director of Quality in Adult Psychiatry at Lifespan. She's a clinical associate professor of psychiatry and human behavior at the Warren Alpert Medical School at Brown University. Her clinical interests include suicide prevention, women's mental health. She has 3 sons, is a member of Temple Habonim, where she served as president for a couple of years, and she is my dear friend. So I'll hand over to Lisa.
Well, thank you very much for having me. I feel in awe to be around all of you. And isn't it amazing? It's almost been a year since this pandemic started. And what I want to do is just talk a little bit about weaving in my life, my personal life and my professional life, because that's kind of what this year's been like for all of us, I'm sure. So it all kind of started almost about a year ago when I had planned this whole trip to Italy. And come February 28th, had to pull the trigger and decide not to go. And then 2 weeks later, I found out my father had end-stage lung cancer. It was a surprise to all of us. So me and my 3 sons, who are in their early 20s, took this drive down to Virginia, where my parents live. And that was really interesting because it was so eerie going down the 95 corridor. It was like kind of empty. And anyway, I knew it was going to be the last time I saw my father because of this pandemic and can't really go anywhere. So it was really something. And he did pass away about a month later, but was so grateful we were all able to see him. As I was there, actually, my boss got in touch with me and asked me if I would be the site director of where I work in our outpatient practice in Providence to help lead this effort in terms of us getting ready to prepare for the pandemic. So I said yes, because, what are you going to do if you get called on? You need to do that. So I had that on my mind, as well as my dad, as we drove back. And my youngest son goes to Brown University, and we had to move him right out of his dorm as we came back up from seeing my dad. So that's sort of how it all went at the beginning. It was amazing to me. We were able to sort of transition into telehealth, right? It was something we'd always want to do and told we can't do it. And it's almost like overnight, we switched into telehealth. And I feel very grateful because I know a lot of my colleagues weren't able to work in the beginnings of the pandemic, and they saw a dip. My practice has been as busy as ever, which, is kind of hard, but I'm grateful we can be there to help support people. And so in the beginning, I felt kind of guilty, actually, because I was working from home. I kind of decided I love working from home. It was great. My youngest son, who's I said was at Brown, decided to take a semester off, so he was home. My middle son was home. My older son decided to move out in the middle of the pandemic, but okay, so he's out on his own now. And so things went, seemed kind of nice just to have everyone at home and be protected. But I did feel kind of guilty, as some of my colleagues who work in the hospital, they couldn't work from home and they had to be there. But but we do calls. So I actually, when I go work in the hospital, I work in the Rhode Island Hospital Psychiatric Emergency Room and cover consults all over the hospital. So come early May was my first time I had to go into the hospital. And that night before I had to go, I was actually really nervous. So I had prepared, I bought these scrubs, I got all these things. I was practicing how to put on my mask, how to doff, put things on, don, take them off, make sure I do everything right. And it was pretty nerve-wracking that first weekend, just trying to get used to everything. I developed a routine where when I go in and I'm working in the hospital, I actually change my clothes and put all my scrubs and everything in a paper bag before I go in my car. Then when I get home, I run into my door, I strip, I take everything off, and I run into the shower downstairs and get washed and then wash everything in hot water and then do it the next day. And I've just kept that up. And I don't know if it does anything, but it makes me feel better. It makes me feel like, I'm being safe. I am divorced, and what I've also done is my middle son has autism. So I'm very concerned about him, and if he, were to get ill, it would be awful. He wouldn't be able to manage it, and so what I've done is his dad and I have worked it out so that when I'm on call, he goes to stay at his dad's house for 2 weeks. So we make sure that if there's anything that happens, like he'll be safe. And that's also made me feel really good that we've, been able to do that. It gives me a lot of peace of mind. Um, so we started seeing people back in the office in June. And it was kind of interesting that there's patients who really want to come into the office, even though we're dressed up like Darth Vader with these masks and face shields and everything. But for some people who've been so isolated, especially my geriatric patients, it's like a big day out. They get to get dressed up and come to the office and talk. But once the pause got put back on, we went virtual again, and we're seeing people in a telehealth capacity. Also, as that happened, I wound up my call frequency was more, so I've been going into the hospital about once a month now on weekends, and the rate of COVID, now it's down, but back then it was going up. And so now I needed to start seeing people who actually had COVID for consults or so forth. And so that was kind of nerve-wracking too. But I realized when you're in the hospital, you have to treat everyone like they might have COVID, because sometimes you get the word afterwards that someone you saw had COVID a few weeks later. So a lot of good that does you, because it's already been a few weeks. But I mean, we have all the gear we need, and we get, able to get dressed up and go in. The first person I saw, though, didn't want to see me. And I remember feeling a little resentful that I had sort of risked my life. So I thought to go into someone who's like, get out of here. But, that goes with, the field of psychiatry. A lot of people don't want to see us. So the other thing, I'm just looking here to see what else is. One thing with my patients is lately, not in the last couple of weeks, but before that, over the last few months, in the beginning of the pandemic, no one really knew that many people who had COVID. And a lot of people that I treated actually it wasn't so hard for them because they're pretty isolated, anxious. So they were like, well, I never really go out of my house anyway. And now everyone's sort of the same. I don't feel like I'm missing anything. But as things have gone on, it's been harder for people. And now it's not unusual that on any given day, I might talk to 2 or 3 people of my patients who actually have COVID. And it's kind of interesting because we're doing telehealth. So I'm actually able to support them while they're going through this. I also got touched by COVID in December. My mother-in-law actually succumbed to COVID, which was tough. My father-in-law almost succumbed to COVID, but managed to come through it. So I've seen the devastation that COVID's wreaked on people, but I too have found some silver linings, working from home, having wonderful colleagues that we can support each other. I feel very fortunate, to have food and a roof over my head. My children are actually doing well despite the pandemic. My older son actually had COVID. He works in a group home. So it was inevitable, but he came through it all right. My middle son works in a cafeteria at Roger Williams. He gets tested twice a week. He's been all right. And thank God he was able to get vaccinated last week, his first vaccine, which I'm really grateful for. I'm grateful that I've been able to be vaccinated. And my younger son's back in college now after he took the semester off, and he's doing well there. So anyway, the last thing I want to say is I don't really feel what I do is more extraordinary than any of you do. We do what we need to do. We take care of our families. We, do the best that we can do. So I think we're all heroes, not just people that are treating people with COVID. So thank you.
Thank you, Lisa. Really, yes, perhaps we are all heroes and heroines. But we're grateful for the work that you do and how you do it, and your humbleness and your humility and your capacity to help people. And like you said, thank God we have Zoom and we have internet, so we can continue to help people even if we don't have to be in the same room with them. You can do this work. It's fantastic. So thank you. All right, so hold on your questions till the end. And now I'm going to introduce our third speaker, who is my friend Linda Steinhardt. So Linda is a certified nurse midwife, family nurse practitioner. She has a master's degree in nursing and a postmaster's in clinical teaching. For the past 29 years, Linda has practiced as a midwife in a variety of settings, including birth centers, hospital-based clinic services, and private practice. She joined Brown University Medical School at Women and Infants in 2002 and is a senior clinical training associate. In this capacity, she is a clinical instructor for medical students and residents training in OBGYN, emergency medicine, family medicine in the emergency and labor delivery units at Women and Infants. She's published and spoken nationally and internationally on development leadership for OBGYN residents, care of the pregnant patient in the ED setting, and a collaborative practice among midwives and OBGYNs. And she's my friend. And she's going to talk to us about what she does and how she does it. And we're all eager to hear from you.
Thank you, Alyssa, and fellow panelists and everybody. Hello. So you can't do midwifery remotely, unfortunately. Preparing this talk has underscored the fact that my method of dealing with working in a hospital during the pandemic has been to not really think about it. I've just been putting one foot in front of the other, and it has surprised me how little I've processed, which I didn't realize till I tried to prepare this talk. And honestly, it's been a challenge to get this talk put together. When I'm scared, my mind gets foggy and I can't think of anything to say. So this is what I came up with. Obstetrics has been defined as long periods of boredom punctuated by moments of sheer terror. And that's very true. I've always been a somewhat fearful and shy person, and that really got in the way in my life. And at some point I realized I needed a method to just let me keep going despite my fear. And so what I started doing a long time ago, way before the pandemic, was I would say a prayer over the hands, and that would help me focus and keep going. And it's helped me a lot, and it might help you too. And most of us know this prayer. It's Baruch atah Adonai Eloheinu melech haolam asher kitshanu b'mitzvotav v'tzivanu el natilat yadayim. Loosely translated, blessed are you, Eternal One, source of all, who guides us in ways to become holy and who inspires us to raise up our hands and be of service. Working during COVID has kind of flipped the definition of more like long periods of terror punctuated by moments of boredom. So you all know how it went. One day you're day drinking at a Purim party, and a few days later the world shut down. You went from having a busy life to bare bones. And the pervading theme of your thoughts was, what is happening? In early March 2020, I was working in the emergency department, and we were all looking over our shoulders as if we could see some invisible invader. No one was wearing masks or social distancing yet. In the following month, many of my colleagues got COVID. Several of them were very sick in the hospital. We couldn't visit. They couldn't really talk because they couldn't breathe. So all we had was texting and email. And these things were so much more than nothing. I spent most of COVID on labor and delivery, on the labor and delivery unit at Women and Infants. It's a hectic and eventful place. It's a big teaching hospital. We do about 8,500 deliveries a year. I'm getting older. And at first, the calculation was it was safer on labor and delivery than in the emergency room because it was a somewhat more controlled situation. Of course, we found out later it wasn't safer because of aerosol transmission. My son asked me if I was going to retire, and I thought seriously about it, but I decided to stay because I can do a lot of stuff that will free up doctors who could take care of very sick people. I discovered it was a great relief, mental relief, to be able to go to work, put my patients ahead of myself. Everything has changed, but guess what hasn't changed? Women have babies. They have labor, they have preterm labor, they have loss, they have fear, they have stress, they have other children, they have partners, they have parents, they have jobs, and they need a lot of support during pregnancy and childbirth, especially during COVID. Here's one story. In the early days of the pandemic, a very pregnant woman arrives at Women and Infants in rip-roaring labor. Because of COVID restrictions, she's dropped off at the door of the emergency room and comes in alone. She speaks no English and she's terrified. Instantly, she's surrounded by staff who are completely covered, talking to her through their masks in a language she doesn't understand as they try to figure out what's going on. A month before, she would have arrived with her partner and possibly another friend or family member who could translate. We had in-person translators as well. Anyway, she's quickly admitted to the hospital. She comes up to the L&D unit where I meet her for the first time. We're using a language app on our phones that has been provided by the hospital in order to communicate. But we have to wait on hold to get someone who can speak her language. So to the tune of on hold waiting, things are moving quickly and there's not much we can do other than help her settle in and catch her baby. Her face blooms into a blissful smile as she holds her baby close. Finally, the interpreter comes on and says, "Do you still need an interpreter?" And we're like, yes, we do. Afterwards, the woman FaceTimes her partner who's sitting in the car in the parking lot. He and their other children meet their new baby for the first time. The woman gestures to me and the nurse and asks us to say hello, and we wave. And it is a happy moment for sure. It's also fraught. This was before we knew how the virus was transmitted and before we were testing everyone on admission. This is what it looked like inside my mind. She didn't have a face mask on. She didn't understand us. She didn't sign a consent. Did we harm her? Does she know what's going on? Did I carry the infection in the room? Did I carry it out? Did I give it to myself when I put my mask on? Did I give it to myself when I took my mask off? Am I taking it home to my husband? Al netilat yadayim. See what I mean? There's a Zen saying, let everything happen to you, the terror and the beauty. Just keep going. No feeling is final. And I love that saying because it acknowledges reality. And it reminds me that I won't always feel the way that I do, and neither will anyone else. And thank goodness for that. Many things are different now. Before, we had a lot of visitors and families able to gather for joy, support, or grief. And now there's only one person. Before, we had the use of our faces and our body gestures, which they say make up 70% of communication. Now we have muffled voices through masks and face shields that cause glare. Here are a few vignettes. A COVID positive pregnant woman is on a ventilator for weeks. She survives, her baby's born prematurely, and lives. I don't know how they are now. A postpartum COVID positive woman wants very much to breastfeed her baby, and she can, with a lot of extra steps and a face mask, alone in her room. I take care of someone in labor all day. Most of the time, she is not wearing her mask. It really seems inhumane to ask a woman in labor to wear a face mask. 2 days later, when I'm back at work, I find out she tested positive. My mind. Fight, flight. How long can I wear this single-use N95 mask anyway? Can I wash it in my Instapot? Do I want to? When's 14 days from now? No feeling is final. I'm called to another patient, another labor room, and the woman was having trouble breathing, and she's wearing a face mask. Take off the mask, I say, while we reposition and assess the situation. And even though she's barely able to speak, she whispers, "No, no, I shouldn't." I mean, who couldn't love a person who cares enough to do that? I'm not even going to address the total lack of leadership during this mess or the horrifying inequities of our healthcare system. But these things are what underlie a lot of our problems. It's hard to find the words to express the gratitude I have for my coworkers, for their support, for friends who have accepted me and didn't shun me because I work in a hospital. A true low point last spring was when all the providers got pay cuts. And guess what? They just kept going. So many people have do more than they're asked, and it's inspiring. A small gesture, a wink, a nod of acknowledgement, a distanced hug. These things go a long way in today's currency of distance. I don't know if there are more random acts of kindness or I just notice them more, but I experience a ton of them. Friends make me scrub caps and masks and bring me food, express curiosity and concern. My husband never has treated me like I was Typhoid Mary, which I actually could be. Last spring, when I ride my bike to work at 6:30 in the morning, strangers would honk and fist bump out their windows yelling, "Thank you," and "You go." And that would really make my day. These small things are actually very big, and we can all do them. I feel an enhanced feeling of gratitude, as the others have mentioned, since this whole thing started. And I get into this rarefied, intense feeling that you get during very big moments when you see the tiniest little details and you can hear the air and see trees grow. I feel like I've been in that state a lot since March. But here's the thing, we're still in it. Here in Rhode Island, we've just been downgraded from extremely high risk to very high risk. It's very scary. I don't know if any of you are going to have a baby anytime soon, or if you experience the need to get out of your own head and into something larger than yourself. But if it sounds like you, then go ahead and try it. El Netilat Yadayim, any time of the day. Or no feeling is final. These words remind us to step back and allow space to let everything happen, including sheer terror, to be helpful and to keep going. Much has been lost, and much remains. We can do something, even if it's just waving out a window or a wink. We just need to do the best we can.
Thank you, Linda. Let that sink in. That was really great. Thank you very much. Moments of sheer terror and like get the sense of the up and downers of life. And thank you for reiterating that we're not done yet. We're still in it. So thank you very much. I'm sure we all have some questions following up, but before we get to the questions, I know many people have been waiting for Rebecca's presentation. So Rebecca, you're next, and then we'll have questions. So Rebecca is a physician assistant who's practiced in Rhode Island for most of her 20-year career in a variety of settings, which include hospital medicine, critical care, cardiology, and cardiac surgery. She received a Master's of Science in Health Sciences from the George Washington University of Medicine in DC, and she's currently working at Lifespan's Cardiovascular Institute in cardiac electrophysiology. Rebecca is a lifelong New Englander, lives in East Greenwich, Rhode Island with her husband, twin 16-year-old daughters, and rescue dog. She enjoys vegetarian cooking and crocheting, is a member of Torat Israel, and volunteers with the Rhode Island Medical Reserves Corps. So now I will hand the floor over to you, Rebecca. Thank you.
Thank you, Alyssa, and thank you everyone for joining us tonight. So at the start of the pandemic, I was working at Rhode Island Hospital on the CTIC, or the cardiothoracic surgery ICU. We had some preoperative patients, mostly postoperative, straight from the OR after getting their cabbages or valves fixed or getting their aortas fixed. They would be in a stable but critical state. They'd be on drip supporting their heart, still on the ventilator. And our job, the PA's and NP's job, was to manage them from that point to the time they walked out the door, when all the lines and tubes and drains were pulled out of them. And then we'd go all over the hospital as well in a consultative service. So when things started getting bad and the hospitals started filling with COVID patients, all elective surgeries were canceled. And believe it or not, this had a big effect on our population. Unless you were just about on death's doorstep, your blocked coronary arteries, leaky valve, widening aorta could all wait. So things became almost eerily quiet. And this was sort of amplified after the no visitor policy was implemented. The hallways were like a ghost town. We were given the option to take vacation time or education time. And this is probably the closest I had to being homebound during this period. I did a lot of education with online resources, and my daughter and I also dragged the old sewing machine out from under the basement steps I've been carrying with me from move to move for 25 years, and we learned how to sew. And I purged and found a lot of trash and some treasures. At the hospital, we were barraged with emails. There were new rules every day, and it kept changing. When we were first told that we needed to wear masks at all times, it felt very strange. And I remember to this day, Dr. Fingleton is one of our most distinguished surgeons. Is walks around with his mask under his chin. He says, "Might as well put a piece of tissue paper over your face." But then it was just a lot extra, and I know we're all sort of echoing each other's thoughts. But as the families and friends were not allowed to come in, it was a lot extra, especially for the nurses. They had to sort of fill that role of being the person to provide comfort and hand holding as patients went through one of the most terrifying experiences you can imagine, being cardiac surgery. We were also barraged with guidelines about how to take care of these COVID patients, as this was also new. It seemed like every other day there was a new PowerPoint slide coming through our email. The intensivists and pulmonologists and infectious disease doctors were all working very hard to digest all this new information that was coming out and give it to us in an understandable format. And as the number of COVID patients rose, luckily Lifespan Administration was watching and learning from the disaster that was unfolding in New York City, and came up with a plan to deal with this onslaught of patients that came our way. They had a tiered system where one after another, a new COVID unit would open up when the last one filled up. So first it was the medical ICU, all 36 beds filled with COVID patients, and then it went on and on. Our unit was never turned into a COVID unit because with how fragile our patients were, if any of them had gotten sick with COVID, it would have been a disaster. However, we did have all these empty beds to fill up now, so we turned into a combination cardiac surgery and neurocritical care unit, as the neurosurgery patients from 2 floors up came downstairs to us, and they turned it to the COVID unit. So this is one of many examples over this time period of us being kind of thrown out of our comfort zones. We received some more PowerPoint slides and an educational binder, and the neuro staff was very helpful and always there when we needed them, but it was still a stretch for us, shall we say. Every population has different needs, and the needs of a neurosurgery patient are a lot different from a cardiac surgery patient. Also, during this period, our nurses were getting floated to the COVID units. They would come back to us with the N95 mask marks etched into their faces, exhausted and headachy from spending hours on end in their PPE. But then it was our turn. That new COVID unit upstairs from us also need PAs and NPs. I was one of the people who volunteered to go there, not just out of the goodness of my heart, but also I had actually given my notice in the CTIC in December, and the start of my new job was delayed because of COVID. So I was kind of done with them anyway. And also I'd learned so much about taking care of a COVID patient. I sort of wanted to see it in action. So as soon as you walk into a COVID unit, you're in a warm zone. When I got to the NCCU door, there were big signs telling you not to come in without your PPE, and I'm holding my bag with my N95 and my face shield saying, where do I put it on? Do I put it on here? Did I walk through the door and put it on? Somebody directed me to the right place. Got some quick introductions and sign out, and then it was off to the races. We had rounds with a physician who was normally a neurocritical care specialist, who is now a COVID specialist, and I did learn a lot. It was just a whole different knowledge set that I needed here. But you know, my years of experience working in the ICU definitely came in handy. And we got to see some of the things in real life that you read about, see in the news, like using remdesivir and convalescent plasma. And then I got my experience as well, wearing the PPE for hours on end, the mask, the cap, the face shields, the booties, the gown, 2 layers of gloves. And it was quite the process putting on and taking it off. There are big posters at the doffing station laying it all out for you, what order you're supposed to do things. And it's a little scary, like that's the moment when you can get some COVID germs up your nose. So you don't want to just throwing stuff on, taking it off. You spend as long as you can in your gear before you take it off. And then I also got to experience how long it takes for patients to recover from this illness. The patients I was assigned had been there for weeks already. The one patient I had who hadn't been there for weeks and was not yet on a ventilator, within 24 hours, he was on a ventilator. I think my attendings would have liked to have delayed that because he was older and had a history of COPD, and there's a good chance he'd never get off that ventilator. But it's especially hard to have these conversations with families when it's over the phone. You have to ask questions that are hard to ask face to face, like, would your dad have wanted trach and peg? Would they have wanted dialysis? If their heart stops, do you want us to do CPR? So after my week on the COVID unit, I decided that this was something that I could handle. And I put a lot of thought into that, just to save my coworkers the risk of going up there and maybe stay out of the CTIC for the remainder of my time at Rhode Island Hospital. Of course, that might mean putting my family at risk if I brought COVID home. So I was looking into temporary housing that Lifespan was offering. The other consideration was that I was diagnosed with breast cancer in 2019. And I was actually very lucky because it was caught early. It was stage 1. I checked with my oncologist and she said that I was not immunosuppressed and should be as safe or not safe as the next person. So I finally got up the nerve to make my offer to stay there. But I guess I was right about the time that things had turned the corner and the numbers were starting to drop. So they didn't need me after all. So just another example of the uncertainty at that time and the uncertainty we still have now. In June, I was finally able to start my new job. You might recall given my notice in December, so that was the longest goodbye ever. I'm in the ambulatory setting now, which has presented a new set of challenges. In the hospital, all the patients are tested for COVID. In the ambulatory setting, there's screens. That is, we ask them about symptoms, exposure, but you don't know for sure. And you're locked in a little room with somebody, and people may or may not be able to keep their masks up over their noses. And the rules keep changing, just like that, as to what type of mask you can wear and whether people can bring visitors in with them or not. A lot of the visits I learned from my colleague who trained me last spring were done remotely, and some of them still are done remotely. So you have the challenge of not being able to check vitals, do a physical exam, do an EKG, and you don't have that physical contact that I would say is part of the therapeutic relationship that a provider has with their patient. But things have definitely turned around for me, and hopefully for the whole world. I've gotten my 2 doses of the Moderna vaccine, thank God, and things are working out well with my new job. This all just needs to come to an end. I see the way my patients suffer. A lot of, everyone's got cardiac problems. A lot of them are elderly, and they've been kind of locked up at home for almost a year now. They're sad and lonely. A lot of people are neglecting their health, whether it's a chronic problem or an acute problem. They'd rather deal with those consequences, the potential consequences of picking up COVID at the doctor's office or the ER. I try to spend a little extra time with people because it might be the first real life human contact they've had in weeks. And it might make my day a little longer, but everybody's days are long these days in the age of COVID. But I'm very much looking forward to a time, maybe this fall, when we can see each other's entire faces instead of just half of them. Thank you very much, everybody. Be well.
Wow, thank you, giving us an insight into your life, into the progression and the evolution of your practice and your work you do. And I know I speak for everybody that we're grateful for people like you who are in the hospitals, and all our panelists and the different works that you do. So we have a few minutes left. If anybody has any questions, any reflections, any thoughts, I suggest that you if you know how to raise your hand, so we don't have everybody talking at once. But if not, just unmute yourself, and hopefully it won't be a barrage of questions all at once. So if anybody has any questions, thoughts, reflections, anything that they'd like to contribute, or just words of applause, anything you'd like to say,
Here's me in my PPE. There's Chaplain Ceceley in the full PPE. That was during the slight period where our washing machines had broken, so we got to wear these paper gowns that felt so much safer.
or not. I think silence is perhaps one of the outcomes of such a profound
Yeah,
sense of what people are doing.
I just wanted to say, I think they are our heroes. For them to go in very terrible situations, I just applaud them and thank them. Yes, that too, I can do that.
I just want to say all the panelists were very, informative and did a great job. And Rebecca, I know personally, and I thank you for doing that. And that was courageous to leave a unit that you're very comfortable with and to go and volunteer for other co-workers and to go into the COVID unit. And that's very admirable, I do. And great job. Thank you.
Thank you, Linda.
If people want to stay on, we've reached our hour, so you can leave if you want. If you want to stay, I'd like to ask each of the panelists where you go with your fear. I think maybe Ceceley touched on it a little bit with her gratitude and her forgiveness and prayer. Probably, I think Linda also mentioned that. I don't know if there's more to say, or the other panelists would like to say anything about how to have a sense of equanimity, how to have a sense of, I want to use the Hebrew word menuchas nefesh, like a sense of peace in your own soul, or whether that's not the goal.
That's always the goal. I don't know that I reach that goal too often. But honestly, I have to say that, I don't, of course, I think about COVID and I'm extremely careful and have to wear all the stuff all day, and I'm very careful, but I'm really it's like it's too awful to think about. So I wasn't kidding when I said I haven't processed a lot of this, and so it was hard to talk about it. So for me, it's really the connections and those moments with people. And I feel very fortunate to be able to actually have somewhere to go and be able to interact with people in this way, because everyone's suffering and scared. And it is a comfort to be able to do it in person with somebody. I don't know if that answers your question, Alyssa, but it's, it's a thing, and you carry it around with you and you keep going.
Do you feel less fearful? I mean, you're delivering now babies wearing full PPEs and masks and gowns and the whole thing still. Mm-hmm.
Oh yeah. Oh yes, absolutely.
Even with your vaccine, even though you're double vaccinated, you've had your 2 vaccines.
Yes, I'm fully vaccinated, but yes, I do. And we all do, everyone does.
I guess I would say, at least when I was trained in medicine and coming up the ranks, you sort of kind of almost like you fake it till you make it. Like one day you're a medical student, the next day you're a doctor, and you have to like act like one, even if you're scared and you don't know exactly what to do. So it's kind of the same thing. You just kind of do it. And now I find, the first time's hard, but each time you go in or you're seeing patients or whatever, it's just maybe it's like Linda, I don't really think about it, but it's kind of like you just do. I mean, you do what you got to do. It's part of the job. That's it. That's what we signed up for.
There's always the fear that you're gonna, catch something, bring it home, gonna pass it to my mom. But it's, I was a classics major. I think about Pandora's box. The one thing left in the box for humanity is hope. That you just can't function without it, especially these days and under these circumstances. You just hope for the best,
Yeah.
for ourselves and our families.
I totally agree with that. And the thing is, this isn't the first horrible thing that's come down the pike. We get the flu every year. It's horrible. We've had HIV. I'm old enough to remember that, and that was terrifying. Ebola. We've had other horrible infections come through. This is the worst one by far. But it's kind of what, like Lisa said, I think it was Lisa, it might have been Ceceley, you kind of signed up to do it, and you do. Just like other people do what they do. It's the same thing.
There's no doubt about it that, like, those of us who are carers, of which I know there are many on this call, not just the four of us who talk, but this is what we do, right? Like we take care of each other. We take care of people, and we take care of each other. And I do think, I do believe that gratitude is the counterbalance to despair. There's no doubt that we can get washed in that ocean of despair, and we can focus on the horrific things, of which we've all seen a lot of truly horrific things. And yet we can also see the beauty, the beauty of our colleagues risking their lives, the beauty of the gift that we get of, holding people's hands in those really precious moments. That, it is a gift to witness someone's last breath. It is a gift to witness, to hold someone's hand and to send them love. It's a gift as well. And we get something out of it as well. Like, we can't, if we didn't, we wouldn't do it, right? Like, there is a certain amount that, like, it is our way of, for me, I'll speak for myself, Chaplain. It is my way that I give back, that I thank, the Blessed One for giving me this life. And I think it's important. The work I do is important, and it's hard and it's exhausting, but I'm grateful to be doing it.
I actually liked being able to leave my house every day. My husband was working from home, and now he's going into work 2 days a week, and so I saw it up close how depressing it can be to be stuck in your house 24 hours a day. And of course, the children last year as well. At least now they get to go in 2 days a week too. But there's something fulfilling about being able to go to your office and do your job in person and hang out with your coworkers.
Not to mention, you can hold it over your family every time they're like, "Oh, I've had a tough day." And I'm like, "Oh, you've had a tough day. Do you want to talk about tough days? Let's just throw down who's had a tougher day." Like, it's to occasionally be self-righteous, right? Like, you've had your tough day.
Yeah, there you go.
I'm sure you all get very tired and you're drained, and then you have to find ways to rejuvenate. What are your rejuvenation tools?
Whiskey helps. Whiskey helps a lot. Whiskey. I take baths a lot. I've taken baths a lot. I listen to audiobooks. Yeah, and sometimes I just go into my room. We're in my office now, where I meet with clients via Zoom. Used to be in person, but now via Zoom. And sometimes I just sit in silence and just am completely quiet. And I sit and I just kind of soak in the quiet and breathe and be in a place where no one needs me for just a few minutes is a big rejuvenating thing for me. Even if it's just 10 minutes of just, I'm alone, it's quiet, I don't have to take care of anybody. Gives me enough energy to then, go make dinner.
I like to be outside, weather permitting. It's almost always permitting. And also the quiet, as Ceceley said, quiet is really wonderful. And I like to go swimming. So for me, physical activity is very refreshing.
There's this new thing, I always like to do puzzles, but there's this new thing called Spelling Bee on the New York Times. I love it. So whenever I have a little moment, I try to find a word or whatever, just good distraction. So I like to do that.
Now that it's staying lighter, a little bit later, I like to be able to get home in time to take the dog for a walk. I like spacing out and watching Netflix and crocheting, and we're fortunate enough to be able to visit my mother, and we have one set of friends we hang out with, our pandemic friends. It's great to see people in person when you can.
All right, I think we're going to wrap it here. We've gone over our hour that we try to hold to, but I think the conversation continues. And even though some people have left because that's the way it goes, but that our panel should know that we appreciate you and what you do. And along with your colleagues and along with other people that do all these kinds of things now in the world, and how much more meaningful they are, and how important each little act is. And in our own ways, hopefully we can do more and be inspired by you, and sort of like pick up our game a little bit from listening to your stories and be inspired by you. I did record it, so I'm planning on sharing the recording. If nobody wants me to do that, please tell me. Otherwise, I'm going to share the recording because I think that it's an important